Heart disease, understanding the number one killer of women in the United States. Despite increased medical advancements, heart disease is the leading cause of death for women in the U.S., a fact highlighted during American Heart Month this February. It is a more significant threat to women's lives than all forms of cancer combined. Understanding the risks and symptoms is the first step toward prevention and survival. The alarming statistics on women's cardiovascular health. Recent statistics from the American Heart Association paint a stark picture of the current crisis in women's health. Widespread impact. Over 4 in 10 women in the United States are currently living with some form of cardiovascular disease. High mortality rate. Cardiovascular diseases, which include both heart attacks and strokes, are responsible for 1 in every 3 female deaths annually. Awareness gap. Many women do not recognize that what is the number one killer of women is, in fact, heart disease. This lack of awareness can lead to delayed diagnosis and treatment. High blood pressure, a primary cardiovascular disease risk factor for females. One of the most significant contributors to heart disease in women is hypertension, or high blood pressure. Prevalence of hypertension. Nearly half of all adults in the U.S., approximately 125.9 million people, suffer from high blood pressure, a silent but deadly condition that is a primary risk factor for heart attack and stroke. Importance of management. Proactively managing high blood pressure in women through lifestyle changes and, if necessary, medication is critical for long-term heart health. Raising awareness with the Go Red for Women campaign in 2026. To combat this health crisis, the American Heart Association's Go Red for Women campaign 2026 is a crucial initiative for promoting women's heart health awareness. The campaign focuses on educating the public and encouraging women to learn the unique heart disease symptoms in women, which can differ significantly from those in men, e.g., shortness of breath, nausea, back or jaw pain. Understand how to prevent heart disease in women by knowing their personal health numbers, including blood pressure, cholesterol, blood sugar, and body mass index, BMI. Schedule regular checkups with their healthcare provider to assess their risk and create a heart-healthy plan. Heart disease is not just a man's problem, it is the undisputed number one killer of women in the United States, claiming more lives than all cancers combined. The prevalence of risk factors like high blood pressure is alarmingly high, yet a critical awareness gap persists. Many women still do not recognize the unique symptoms or the sheer scale of the threat. The statistics for 2026 are a clear warning. Cardiovascular disease is a silent epidemic that demands immediate and personal action. Don't become another statistic. This American Heart Month, take control of your cardiovascular health. Your life may depend on it. Schedule a checkup, talk to your doctor about your personal risk for heart disease. It's the most important appointment you can make this year. Know your numbers, learn your key health metrics, blood pressure, cholesterol, blood sugar, and body mass index, BMI. Knowledge is power. Learn the symptoms, educate yourself on the signs of a heart attack and stroke in women, which can be subtle and different from men's symptoms. Share this video, and talk to the women in your life, your mother, sisters, daughters, and friends. By raising your voice, you can save a life. Go Red for Women. And if you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit that notification bell so you don't miss our next video. Thanks for watching, and we'll see you in the next one.